Hello everyone, and welcome back to Mr. Adam and Miss Sarah's channel, where learning English is easy and fun. I'm Sarah.
Hello, Sarah. Hello, everyone. It's great to be here.
Hi Adam, how are you doing today?
I'm doing great, thank you. And you look very happy today.
I am very happy. I'm excited about our topic today.
Oh yes, it's a very good topic. Very important.
Today we're going to learn how to talk about your job in English.
Sarah, it is lovely to see you again. How have you been?
Adam, I have been quite well, thank you. Work has been busy, but that is normal for me. How about you?
I am well too, thank you. School keeps me busy as well. As you know, I work as an English teacher at Greenfield Secondary School.
Yes, I remember. How long have you been working there?
I started working there in September 2018, so it has been almost 8 years now. Time goes so quickly. And you? You work at St. Mary's Hospital, do you not?
Yes, that is right. I work at St. Mary's Hospital in the city centre. I started there in 2020, during the pandemic. It was a very difficult time to begin a nursing career.
I can imagine. That must have been challenging. Do you like your job?
Yes, I truly do. It is hard work and sometimes I feel exhausted, but I feel proud of what I do. Helping people when they are sick or frightened gives me a sense of purpose. What about you? Do you enjoy teaching?
I do. I enjoy it very much. Teaching English allows me to meet young people from different backgrounds. The best thing about my job is seeing students improve. When a student who was shy at first begins to speak confidently in English, it makes me very happy.
That sounds wonderful. Do you have many students from abroad?
Yes, quite a few. We have students from Europe, Asia, and Africa. When new students arrive from abroad, I try to make them feel welcome. I speak slowly and clearly, and I pair them with a friendly classmate who can help them. I also give them extra worksheets and sometimes stay after school to support them. Moving to a new country can be frightening, so I try to show kindness and patience.
That is very thoughtful. In my job, I also meet people from many different cultures. Some of my patients struggle with mental health problems, such as anxiety or depression. When that happens, I listen carefully and speak gently. I never judge them. Sometimes they simply need someone to hear them. If necessary, I contact the mental health team for extra support.
That must require a great deal of emotional strength.
It does. There are sad situations as well. I remember one elderly patient who had no family visiting him. He felt very lonely. I sat with him during my break and talked about his life. Sadly, he passed away a few days later. I felt heartbroken, but I reminded myself that I had given him comfort in his final days.
That is very touching, Sarah. In my case, the sad moments are different. Once, one of my students was being bullied because of his accent. I felt upset and disappointed. I spoke firmly to the class about respect and kindness. I also reported the matter to the head teacher. Thankfully, the situation improved.
I am glad you dealt with it properly. Do you have any funny stories from school?
Oh yes, many. Once, I was teaching vocabulary about animals, and a student confidently told the class that a sheep was the wife of a ship. The whole class burst into laughter, including me. We all enjoyed that moment. What about you? Any funny situations at the hospital?
Well, one patient once tried to give me a biscuit as a medical fee. He insisted it was the best payment he could offer. It made us both laugh, and it lightened the mood on a very stressful day.
That is delightful. Do you work day shifts or night shifts?
Mostly day shifts, but sometimes I work nights. Night shifts can be very quiet or suddenly very busy. They are tiring, but I appreciate the teamwork among the nurses. Do you like your manager?
Yes, I do. The head teacher is supportive and fair. She listens to our ideas and encourages training courses. And you?
I like my manager as well. She understands the pressure we face and tries to arrange the rota fairly. It makes a big difference.
Do you get breaks during your shift?
Yes, though sometimes they are short. I usually spend my break having a cup of tea and chatting with my colleagues. It helps me relax. How about you?
I have a lunch break at midday. I often sit in the staff room, mark homework, or speak with other teachers. Sometimes I take a short walk outside to clear my mind.
May I ask, do you have anyone in your family who is also a teacher?
Yes, my mother was an English teacher as well. She inspired me to choose this profession. And in your family?
My older sister is a nurse too. She encouraged me to apply to nursing school. It is nice to share experiences with her.
If you do not mind me asking, are you satisfied with your salary?
Nursing salaries are not always as high as people expect, but I believe it is fair for the work I do. Of course, I would not complain about earning a little more. And you?
I feel the same. Teachers deserve higher pay, in my opinion, but I value the holidays and the meaning of the job more than the money.
That is very true. Where do you see yourself in 5 years?
In 5 years, I hope to become head of the English department. I would like to design new courses and support younger teachers. And you?
I hope to specialize in mental health nursing. I would like to train further and perhaps lead a small team. Most importantly, I want to continue helping people with compassion.
That is admirable, Sarah. It seems we both chose careers that serve others.
Yes, and although our jobs are demanding, they are also meaningful. I believe that makes all the difference.
Sarah, I have always been curious about your university days. What subjects did you study when you were training to become a nurse?
That is a very good question, Adam. Nursing is not only about caring for patients in hospital, it is also very academic. I studied for 3 years at university, and the course was quite demanding. We had both classroom lessons and practical training in hospitals. I will try to explain the main subjects in detail.
Yes, please do. I would like to understand it better.
First of all, we studied anatomy and physiology. That was one of the most important subjects. Anatomy is about the structure of the human body, and physiology is about how the body works. We learned about all the systems of the body, such as the cardiovascular system, the respiratory system, the digestive system, and the nervous system. We had to understand how the heart pumps blood, how the lungs take in oxygen, and how the brain controls everything. It was very detailed, and sometimes quite difficult, but it gave us a strong foundation.
That sounds rather complex. Did you have to memorize many things?
Oh yes, a great deal. We had to learn medical terms, the names of bones and muscles, and how different organs function. At first, I felt overwhelmed. However, with time and practice, it became clearer. We also studied pathophysiology, which is about how diseases affect the body. For example, we learned what happens inside the body when a person has diabetes or heart disease.
I see. So you had to understand illness at a scientific level.
Exactly. Another important subject was pharmacology. That is the study of medicines. We learned about different types of drugs, how they work, their side effects, and how to calculate correct dosages. This part was very serious, because giving the wrong dose could be dangerous. We practiced drug calculations many times to make sure we were accurate.
That must require a lot of responsibility.
It certainly does. We were taught always to double-check everything. Safety is extremely important in nursing. Alongside pharmacology, we studied clinical skills. In this subject, we practiced taking blood pressure, giving injections, dressing wounds, and inserting cannulas. We trained in simulation rooms that looked like hospital wards. At first, we practiced on mannequins before working with real patients.
That sounds quite practical. Did you enjoy that part?
Yes, very much. It made me feel like a real nurse. However, I was also nervous when I first worked with actual patients. Fortunately, we were supervised by experienced nurses who guided us.
Were there any subjects about mental health?
Yes, indeed. We had a full module on mental health nursing. We learned about conditions such as depression, anxiety, schizophrenia, and bipolar disorder. We studied how to communicate with patients who may feel confused, distressed, or frightened. We were taught the importance of empathy and active listening. This subject touched me deeply because mental health is often misunderstood.
That must have been emotionally challenging.
It was. We also discussed ethical issues, such as patient consent and confidentiality. That was part of another subject called Professional Practice and Ethics. In that module, we learned about the legal responsibilities of nurses, patients' rights, and how to maintain professional boundaries. We studied real-life case studies and discussed what we would do in difficult situations.
I imagine ethics is very important in healthcare.
Absolutely. Trust between a nurse and a patient is essential. We also studied public health. That subject focused on preventing illness and promoting healthy lifestyles. For example, we learned about vaccination programs, nutrition, smoking cessation, and community health services. It helped us understand that nursing is not only about hospitals, but also about supporting the wider community.
That is interesting. I had not realized nursing included community work as well.
Yes, many nurses work in schools, clinics, or patients' homes. During our training, we also had placements in different areas. I worked in a surgical ward, a care home, and a mental health unit. Each placement lasted several weeks. These experiences were extremely valuable because we could apply our knowledge in real situations.
Did you have exams as well?
Yes, we had written exams, essays, and practical assessments. Some assignments required us to reflect on our experiences. For example, after a placement, we had to write about a situation we found challenging and explain how we managed it. Reflection is an important part of nursing education because it helps us learn from our experiences.
That reminds me of teaching. We also reflect on our lessons to improve.
Exactly, Adam. Continuous learning is important in both our professions. In our final year, we also studied leadership and management in healthcare. This prepared us for working within a team and understanding how hospitals are organized. We learned about communication within multidisciplinary teams, including doctors, physiotherapists, and social workers.
So you were trained not only to care for patients, but also to work with colleagues effectively.
Yes, teamwork is essential in nursing. Without good communication, mistakes can happen. We were taught to speak clearly, write accurate reports, and hand over information properly at the end of a shift.
Listening to you makes me realize how demanding your studies were.
They were demanding, but also rewarding. There were moments when I felt stressed, especially during exam periods. However, I had supportive classmates and we studied together. We encouraged one another when things felt difficult.
Looking back now, which subject do you think helped you the most in your current job?
I would say a combination of clinical skills and mental health studies. Clinical skills help me perform tasks confidently, while mental health training helps me communicate with compassion. In reality, all the subjects were connected. Nursing is both science and humanity. You must understand the body, but you must also understand the person.
That is beautifully said, Sarah.
Thank you, Adam. University prepared me well, but I am still learning every day. Nursing education does not stop after graduation. We attend regular training sessions and update our knowledge. Medicine changes quickly, and we must keep up to date.
I truly admire your dedication. It seems that nursing requires intelligence, patience, and kindness all at once.
That is very kind of you to say. I believe both our professions share that quality. We both care for people in different ways. Teaching shapes minds, and nursing cares for bodies and hearts.
I could not agree more. Thank you for explaining your studies in such detail. I have gained a much deeper respect for your profession.
You are most welcome, Adam. I am always happy to speak about my journey. It reminds me why I chose this path in the first place. And that's where we'll leave it for today. Do remember to subscribe, give us a like, and share the podcast with friends and family. It truly means a great deal to us. Thanks ever so much for listening.